this is the doctor who's actually a anaesthetist as well, but he specialises in bloods. Careful of the camera, Frankie Jack, don't knock it. You'll have to give me your name, I'm so sorry.
Yeah, Dr. Raul Bacardi.
Dr. Raul Bacardi.
Yes.
And he's just gone through everything with me about what low iron deficiency causes. And symptoms, isn't it?
Yes.
All my symptoms, everything that I've got. So at the moment, as I've told you, the NHS's guidelines are between 10 and 291. So when my iron, my ferritin, he was saying ferritin, because it says the tin, it's your stores. When it was sat at 24, they were saying it's fine because that's the NHS guidelines. And unfortunately, doctors and GPs, and this has come from a doctor's mouth, doctors and GPs don't get enough training when they're training to be GPs to know all about it. It's a very fraction of their training of what they do for low iron, so they don't know enough about it. So now I'm going to have an iron infusion, and I'm a wimp with needles. You might need to move to this because we see your backside.
You better stop recording that.
Do you want to start? Can you go here? So can you see what I mean? That's it.
Yeah. You take your watch off.
My watch off. I can't take my
You're
bracelet
left-handed
off.
or
I'm right-handed. Do I need to take? I can't take that off, unfortunately.
Is that one of those magnetic things?
No. It's my wedding band. Yeah. So this is a cannula. Don't tell me what you're doing because I'm a bit weak with needles.
Just use
This is Dr. Caitlin Scott, who I've been talking to on the phone.
I hold the hand.
You hold my hand. You're going to be chatting to me later, aren't you?
Yes. We can chat about everything. Any questions that you have.
I'm alright with it.
Subscribe.
It's okay. Don't worry.
Ah!
Squeeze my hand rather.
Wow! What a wimp.
Oh no.
Woo!
What's the matter?
It's the other benefits of having an anaesthetist.
Yes.
Do this.
Yes.
It's what he does.
Yes, is it every day?
All day. So he's the best person.
So you've given the most iron infusions, haven't you, out of any doctor in the UK?
I'm not sure about it, right?
I bet it is.
Yeah.
Be modest.
So this is what Dr. Raul explained what ferritin was. It's true low iron deficiency if you're low in it. It's like your oil storage. And then iron has to be carried by a protein. That's your trans ferritin saturation. That's like your tanker, you know, your lorry. And it's carried into your muscles, your brain, your immune function and other parts of the body. Also for hair and lots of enzymes, including your thyroid. This is why it is so important in the body that it's not low. The problem that low ferritin with me has caused is the fatigue, the tiredness I continuously feel. Also breathlessness, bruising easily, restless legs, problems with my sleep, hair loss, brittle nails, lack of concentration, anxiety, and it can also cause in some people depression as well.
This is the iron.
The black.
Yeah.
That's the iron that's going to go into me now. Can you see that? Dr. Caitlin's just waggling it around.
Can I take the machine?
Yeah. Wow.
Okay, that's fine. I just need the blood pressure cuff next door for 1 minute, okay?
Okay.
Your blood pressure is normal.
So after the iron infusion, they're actually saying that the iron, I will start noticing the benefits within anything between sort of 4 to 6 weeks. I may notice a little bit of a difference after a week, but it's going to be mostly 4 to 6 weeks, maybe even 8 weeks.
Drugs everywhere. It's so small. It's so small.
You're hungry, lift the weight a bit. You've got to. You have to.
Okay, you better. Right. You will start it now. If you feel anything, you just have to let us know. Alright?
Okay.
Infusion lasts around 35 minutes.
35 minutes, okay. Do you do it for 35 minutes or do you do for 5 minutes and then stop?
Then
Or
we'll,
do you-
we'll review every few minutes anyway.
Okay.
So if there's anything, we'll stop it and restart. Otherwise, continuous infusion over 35 minutes. That's it.
Putting a pint of Guinness into you.
Yes! You're spot on. Okay, I'm
So
going to
here we
start.
go.
I'm going to start now. It's a drip, alright?
Okay.
Your ferritin levels should sit at 100. The guidelines on the NHS at the moment are between 10 and 291 in my area, which is East Lancashire. So if I go to the doctors with a ferritin level of 24, my GP looks at it and thinks that that's absolutely fine because of the training that's given in medical school is so minimal. And then if they're going off the guidelines, so you can't actually blame the GP. It's what they're taught within medical school. But because mine was sat below 30, that's why I had all the symptoms. Also, below 15, you're actually no ferritin in your body whatsoever. Now, it's caused by many things, is low ferritin, low iron deficiency. Things like giving birth, pregnancy, loss of blood. It could be breastfeeding. It could also be menorrhagia, which is heavy periods within women. So it's really common within women. 1 in 3 will suffer with it in their lifetime between the ages of 30 and 60. It's most prominent. Men can suffer from it, but you've got to find where it's coming from because, as Dr. Rao called it, they'll have some sort of open tap within their body where blood is coming out. So they need to find and obviously stop that. It can also affect people with irritable bowel syndrome, IBS, because you're less likely to be able to absorb the food that you're having. And if you are trying to eat a rich iron-based diet, you're not supposed to have tea or coffee within 2 hours of that meal because it just cancels out the iron that you've just taken. So really important. Tea or coffee is good for you, but obviously everything is good for you in moderation, but don't have a tea or coffee within 2 hours of having iron-rich foods. You can actually go and ask for a full blood count at your doctor's, but make sure you ask for them to put ferritin, transferritin saturation, and serum iron on that list for them to check. Because your ferritin can read higher than normal if you've got any infection or any inflammation within the body. Also, the transferritin saturation, so your ferritin can read absolutely fine. So you've got plenty of stores, but your transferritin might not be doing its job properly and might read at a lower percentage. And if that's the case, they would treat it in the same way. But you also need to find out why this is happening. Are you not absorbing the iron in your food? It can be menorrhagia if you're having heavy periods. It could be because you're pregnant, because you're breastfeeding, because you lost a lot of blood during the birth. It could also be things like kidney problems. Cancer patients can have this, and also IBS, irritable bowel syndromes. There's lots of different reasons, and obviously the doctor needs to get to the bottom of why this is happening to you. Last year, there was a study done in Copenhagen between 2017 and 2018. They gave women who lost a lot of blood during delivery, that's giving birth, an intravenous iron, so the iron infusion that I've just had. And the women's well-being and their breastfeeding was a lot better than the women that were just given the tablets, the iron tablets. There has been a study that links baby brain, so after we give birth, to low iron deficiency, and that causes obviously the fogginess within your head. And at the moment, there's further research being done, I think it's in Copenhagen, between postnatal depression, postnatal anxiety, and the link with that with low iron deficiency, that's low ferritin. Dr. Rao was telling me that if you ask the iron companies, there's more iron that goes to farm animals than there is to humans, because pigs don't get to roll around in mud, so they don't get iron into them like they used to, so they have to have regular iron injections. So actually pigs are getting more iron than us as humans.
Hello, young man. You want to become a doctor?
He's going to work on Harley Street, aren't you, Frankie Jack?
Yeah, maybe got involved because of our research work. Because I work in Marsden. I work in cancer hospital. So.
You work in the cancer hospital?
Your blood pressure hasn't changed at all during infusion, okay, and you don't have any asthma or anything, so
No.
that's good.
So I'm fine.
You're fine.
Link in the bottom of the description to a program that was on BBC Radio 4 with Dr. Beverly Hunt on a clinical study that's been done in Zurich. So if you went to the doctors and they were to put you on something like ferrosulfate, they would probably recommend you taking 2 or 3 tablets every single day. But actually this clinical study proved that taking 1 tablet every other day of 60 milligram allowed your body to absorb it 30 to 40% better than taking 2 to 3 iron tablets a day. And that's because the body absorption, because if you overload the stomach with the iron, it gives a signal to the liver, and the liver prevents further iron absorption. So the link will be left below. If you are on iron supplements, it must be taken on an empty stomach with vitamin C, and that also helps it to absorb into the body better. The Iron Clinic will now write to my doctors explaining what I've had done, and they believe that my iron could be low, my ferritin, due to my body not absorbing the iron. So we need to find out why. So I've actually gone back to my doctors, and my doctor has now referred me to gastroenterologist. So I will have an appointment for that in the next few months. Our body cannot produce iron. It needs to be given iron. So that's where it has to come from our diet. So we need to be eating better iron-rich foods if we are lacking in iron. Because, of course, you can be the other way. I'm talking about low iron deficiency. So processed foods, junk food, it's not good for you. But this is what we tend to reach for when we feel low and tired. And that's why they think that I might have had the weight gain as well. If you feel this may be you, please go and get checked out by your doctor. Make sure you have that full blood count with ferritin, transferritin saturation, and your serum iron. Get your bloods printed out and send them off to the Iron Clinic. Pop my name on there as well. Please go and do it. It can be very, very debilitating. Some people can suffer for 10, 15, even 20 years with this. Low iron deficiency also affects the immune system, so they think this could be why I've had so many chest infections and why they have been quite severe over the last couple of years. Breathlessness is one of the symptoms, and obviously the primary function for why we breathe air is for oxygen. Oxygen goes into our lungs, carbon dioxide comes out, and the hemoglobin in your blood carries the oxygen around your body. So if that isn't functioning right because of the ferritin, you are going to get breathless. However, your hemoglobin can read fine, but if your ferritin is low, you can still suffer from that breathlessness. They're just emptying the last bit of iron into me from the syringe, and then they're going to remove the cannula. I am such a blooming wimp. They're just removing it now. Please don't forget to subscribe and press that bell notification button, and please leave your comments in the section below as well. Thank you for joining the family. My YouTube channel is about my life working in television, my life with the family, but also crafting, fashion, all the superficial things that make us feel good, but also about well women. So I've been talking a lot about bereavement since losing my father, and also this low ferritin. Thanks for joining. Love you lots. Thanks for becoming a member of the family, and I'll see you tomorrow.